Here I'm going to talk about the step-by-step process of circumcision. So before the circumcision, the baby boy is taken from his mother to where the procedure will be performed. And also, the baby boy, or he is spread angle to the hard restaining board. And right, so baby will not move, and it is safe for the baby. And before this procedure, the penis is, sewed with the opposite, traumatic areas or any cleaning or make it sterile. So only about 1/4 of baby will receive anesthesia. And anesthesia might reduce baby boy pain somewhere, but no anesthesia is effective to eliminate all of his pain. So they said to mark the level at which the circumcision is to occur. So we have to mark in this area. This is the foreskin need to remove. And local anesthesia may be used at this time. So here what we see, marking, right? Mark the area. And then gently separate the foreskin from the glans penis. And now cleaning the inner side and prepare it for remove. And this is retract the foreskin to back direction. And here we can see the circumplast and plastiband. So circumplast it is this one sterile procedure or sterile single-use circumcision device type of, and that is supplied with a ligature. So this is to make a dorsal slit long enough to ensure that the circumplast device can be inserted. And plastibell make a dorsal slit and long enough to ensure that plastibell device can be inserted. So here we can see the first steps. Usually the doctor, two doctor come, do this one. So doctor inserted a probe, right? Inserted a probe in between boy's foreskin and the glans in order to separate it from the head of the penis. So you see, and then the surgeon moved it in a circular motion and explaining each of his action to the resident, if the adult. And this action is striking a scarlet under the foreskin and slowly remove it. And now you see the scissor, right? So now the doctor then very slowly made a vertical slit with his scissor. This is the scissor. And in agonizing the pain, the newborn baby are pulled at the restraint. And doctor then exposed the bleeding red glands further, and also pointing and making more medical observation, if any, usually to trainee located on intently. You see, they insert the circumflex device until the coronal sulcus has been reached. So this is the device put circumflex, and this is the plastivel. Now you can see very clearly. I was talking about the circumflex. This is the device. And this device, little bit different, plastivel. So these are two techniques. And circumflex is a sterile, single-use circumcision device that is applied with a ligature. So in this picture or animation, provide a general overview of the process or procedure when conducting a circumcision using the circumflex. And second picture, this one, plastivel. Plastivel, this is the technique, is one of the most common method of the newborn circumcision. And plastivel technique or plastivel has to advance to continue hemostasis. So why we use it? To stop the bleeding. So after the procedure, this help to hemostasis as the suture remain in place for a few days. And also the newborn with a plastivel, a circumcision, is the surgery to remove the foreskin. It is help to remove the extra skin from around the end of the or tip of the penis, right? And circumcision is usually done in a doctor office or usually done by the physician. So they say the ligature can be tried with a resting positions of the foreskin. The skin must be pulled directly in order for the mark of rich growth where the ligature can be secured. So here we can see that vertically all inner mucosal skin can be removed and used because of using circumflex automatically. And inner layer mucosal skin cannot be using the plastivel. So ligature and now say the circumflex device has no force pulling it directly. In this event, that the diaper push the device distally, and this is the forcefully plastivel device distally, which causes the proximal migration of the foreskin. So here we can see the intervention required. So doctor can have to observe, right? The doctor then look the area of suturing area or scalpel, and also the doctor then remove the clamp and also bell, revealing completely exposure the foreskin free glands. This one. So now after several days, you see the cutting the suture. It is naturally it is fall because it will be dry. So now here I said that doctor then remove all of this and also observe and made the baby and check for the any excess, I mean pain, right? If any pain is not, or also insert the completing the operation and just go for observation and give some pain medication like Tylenol, no ibuprofen.